So my name is Josef Murad. I'm the CEO and co-founder of BYON8. So what BYON8 is about is that we are a digital health application and we mainly provide two services to our users. We have something called a Symptom Checker and we also have online consultations with doctors. So the Symptom Checker is kind of like a self-triage tool where users can input their symptoms, the app asks them questions and then gives them recommendations and possible causes. So almost like you're talking to a doctor, but it's within the application. And then beyond that, we also do provide online consultations with doctors 24/7. So you can consult with a GP or a specialist any time of the day to give you that kind of convenience in the service. And we also do referrals. So for example, if we need any physical follow-up, lab tests, x-rays, etc., all of that is included in the service. So to summarize, it's kind of like a digital outpatient experience for the user. Our services start at the price of $395 bob for a GP consultation, which we do think is fairly affordable, at least looking in the market. But also the question is about subsidization, like how do you finance these consultations? How can you make it even more accessible, maybe even free for individuals to access? And that's really where collaborations with partners come in, right? For example, working with the insurance industry, working with corporates, working with the ministry, integrating with insurance schemes like NHIF, for example, to increase the accessibility as well. The potential in Kenya, East Africa, and the African region overall, I think, are kind of limitless because the opportunity you have is very unique because a lot of the technology, let's say, that has been developed in other countries, let's take, for example, Sweden, where we've developed the technology, is you're seeing countries like Kenya leaping over generations of development. So for example, with M-Pesa and mobile payment, that didn't exist in Europe, but it was here in Kenya before. And the reason for that was because you needed to find out a payment infrastructure that worked for everyone. And the similar thing is happening in healthcare right now, where you need a digital solution not only for primary care and accessibility, but for health data. There are many different pain points that we're trying to solve. The opportunities that we have here in Kenya, let's say, in many other countries, is there are a lot of unemployed doctors, and what solutions like this does is it can actually employ them and give them a place to work and activate that pool of doctors that wouldn't be in the healthcare system otherwise, and make sure more people can actually access the services, and ultimately then also bridge to the UHC and the primary care efforts and work towards that goal of universal access to healthcare. Partnership building is key in any business that you work in, and especially in the healthcare sector. You can never either create something or do something all alone. That's not going to work. And especially in the healthcare sector, where you need to look at financing and subsidization and other areas. And often you also do find that partners are very keen on doing something together with you as long as you do provide a solution that addresses their pain points but also is scalable. So I would definitely say that the partnerships we've built so far, both public and private, have been very successful, and also one of the keys to our growth in the Kenyan market. The East African Health Expo is a great opportunity to meet the right players, partners, build the right partnerships as well, and meeting the stakeholders that will facilitate your journey and your growth, and make sure you succeed and achieve the goals that you've ultimately set for your company. So it's a great opportunity to interact, meet, and I would definitely recommend attending the event.